Sickle cell disease is the most common genetic disorder in the United States, and yet the amount of support that sickle cell disease gets is significantly less than other genetic disorders that are much, much less common.
In the fierce competition for research funding, advocates for many conditions feel shortchanged. It often comes down to who has the best organization and clout. Many patients with sickle cell are poor, minorities, and lack influence.
Because of socioeconomics, the lobby that advocates for research, for progress, is not a strong one. And this also has a major impact on funding levels. So there's clearly, without doubt, there is a socioeconomic aspect to sickle cell disease.
The article in Pediatrics also examines the role of race, stating, quote, "As a country, we continue to struggle with the implication of past and present racial bias for health." Besides inequity in funding, there are problems delivering care to sickle cell patients, particularly young adults. There's a shortage of sickle cell specialists. Ongoing treatment is often fragmented. The healthcare system is hard to navigate, and many lack insurance. One consequence of all this is that many patients do not seek medical attention until they're in dire straits. They head to the emergency room in search of narcotics for pain that can be as severe as that of a broken bone, but not as obvious. It can be a confusing situation for medical staff and result in undertreatment.
One of the things that doctors and nurses are looking for are patients to demonstrate pain behaviors that's appropriate for the amount of pain they're having. Somebody that's grown up with pain their entire life has learned to compensate for that pain, and so typically they will not show those kinds of pain behaviors.
On top of all these challenges, there are communication problems caused by differences in race and/or culture. To stay out of these emergency room scenarios, sickle cell patients need quality, ongoing care. But in 2010, Arthur Brown found himself missing just that. He became unemployed, lost his health insurance, stopped going for his monthly blood transfusions, and became deathly ill with pneumonia. Brown ended up in Akron General's intensive care unit, on a ventilator in a medically induced coma, fighting for his life.
Would he wake up? I was worried about being in like that. Would he wake up? Would they be able to bring him out of it?
That's the moment, like, when I actually realized how much I really did love him. And I just wanted to be with him no matter what, so I was there for him.
And I came off the ventilator, and I was like, well, that was pretty much it right there. Like, that's the closest I've ever been to actually dying. So it's like, man, I'm straight. I was like, I don't think it could get much worse. Hopefully it doesn't. But to me, it's like I've been there and back now.
These days, Arthur Brown has a full-time job working for the Cleveland Clinic reading EKGs for heart disease patients. He feels blessed to be back on his regimen of monthly blood transfusions. His pain attacks now come less frequently, and he usually only ends up in the hospital once a year.